Healthwatch, brought to you by Dune Surgical Hospital and Mercy Medical Center.
Chronic sinus infections often need surgery, but sinus surgeries are normally complicated.
Siouxland News reporter Kat Taylor shows us a new procedure that could result in less pain and a faster recovery.
Sinus infections. 1 in 8 people watching this story will get one or more in their lifetime.
When one gets a sinus infection, many of the common symptoms are headache, facial pain and pressure, a stuffy or blocked nose, drainage, maybe a toothache. All of those things can signify a sinus infection.
Some patients who get chronic sinus infections have to get sinus surgery to achieve relief. But not too long ago, sinus surgery involved removing bone from the sinus cavity. Dr. Tom Kinney is an ear, nose, and throat physician at ENT Consultants, and he says that the new procedures make surgery less painful.
People have heard all the horror stories about sinus surgery and the complications of sinus surgery. In general, it's very safe, though. The methods we use now are very nice and precise. We have Instatrack scanning, which we can use image-guided surgery, so very precise placement of the instruments that we use in the patient's noses.
The new procedures Dr. Kinney uses involve balloon dilation and stents, and they both can be done in the clinic.
You deploy a guide wire into the sinus in question that's obstructed, and then over the wire you deploy a balloon, and the balloon is then inflated to 12 centimeters of water, and then you can actually rinse the sinus out if you needed to. Once sinus surgery is undertaken, one of the things that ruins sinus surgery, good sinus surgery, is scarring. So a surgeon's going to do everything in his power to prevent it. And this particular device is called the Propel device. It's when deployed, it springs open and it stents the sinus open, and it's also coated with a steroid which limits inflammation in the scarring and promotes healing.
For Siouxland News, I'm Kat Taylor.